Patient classification system. It is used to measure the workload of the nursing staff. It is having the characteristics. Mnemonic is RAT SSN. R is reversible. A is auditable and individualized. T time bound. S specific. S simple. N is need oriented. So next topic, methods of categorizing patient. Mnemonic is DAM. D is diagnosis related group method. It is called as DRG method. And activities of daily living. A is activities of daily living. ADL. And N nursing care intensity method. NCI. Okay. So first one is, so here we are having the three methods. One is DRG method, DRG method, ADL and NCI. DRG is called as diagnosis related group method. ADL is activities of daily living, and NCI nursing care intensity method. Okay, ADL. This ADL it's further it is given by GARDS index and Manchit-Wati scale. Okay, so GARDS index, it is having the 6 activities. One is bathing, dressing, toileting, transferring, continence and feeding. Okay, so here we have to give a score 1 for one score for all these 6 activities. If he is done the activities, or if the patient cannot do abdina, we have to give the 0 score. So the score maybe ranges from 0 to 6. 0 means the patients cannot able to do, so he is fully dependent. Then 6 is the patient can do his activity, so we are giving the 6 score and it is independent. Okay, so this is called GARDS index. And next is Manchit-Wati method. Okay, so this is this scale is used for medical surgical ward. So here we are assessing the here having the 4 activities. Okay, 4 activities can be assessed. One is bathing, dressing, toileting and feeding. And it is categorized into 4, whether the patient can do by himself or the patients need some supervision, and if the patients can or nurses has to do and the patient can cooperate, or the patient is fully dependent on the nurses or his relatives. Okay, in this way it is classified into 4 categories. Okay, so for each category we are giving 1 marks. Okay, 1 score is given, so the total score is 4 to 16, not 24. 4 to 16 is the total score. Okay, and we are categorizing the patient into 4. Okay, one is for category 1, if the score will be 4, the patient is independent and no self-care deficit is there. And if he is category 2 na 5 to 8, then he is a mild dependent and mild self-care deficit is there. And 9 abdina 9 to 3 category 3 means 9 to 12, the patient is having a moderate dependent and a moderate self-care deficit is there. Okay, and category 4 13 to 16, it is fully dependent and severe self-care deficit is there. Okay, so this is the second one, that is nothing but activities of daily living. Okay, and next third topic is nursing care intensity method. Okay, this method is used for neurosurgical patient. It is having the 6 component: levels of consciousness, nutrition, risk for developing bed sore, and then pressure, personal hygiene, elimination and mobility. Okay, so again it is having the 4 scales is there, or 4 categories is there. Okay, we are giving 1 marks for each thing. So it is having 6 components, so 1 is 1 into 4 is 1 into 4, 6 into 4 is 24. And we are giving 1 score for each, 1 mark, so the total score is 1 to 24. If the patient is getting score less than 7 abdina, category is 1, he is independent. And 7 to 12, okay, 7 to 11, category is 2, it is between the dependent and independent. Next is 12 to 19, he is third, category 3 and dependent. And if the score is more than 19, it is category 4 and fully dependent. Okay, so that's all about the methods of categorizing patient, DRG method, ADL and NCI. Okay, and next is types of patient classification system. So here we are having the 4 different types: hospital system study group method, and OLU patient classification system, and another one is Rafaela classification system and Zebra system of patient care. Okay, so first one is hospital system study group method. So here we are having the 4 categories as seen in the previous one, that is in the GARD scale. Okay, GARD scale. No, it is in as like the Manchitwati scale. Okay, bathing, dressing, toileting, and feeding. Okay, so here we are classifying the patient into 4 groups. Okay, so that is the first one, hospital system study group method. Okay, whether the patient is self-care or average nursing care is needed, above nursing care is needed, or intensive nursing care is needed, like that we are classifying here. Okay, so next is always patient care. Here we are having the six subscales are there: planning and coordination of nursing care, bathing, blood circulation and the symptoms of disease, elimination and personal hygiene, nutrition and medication, activities, rest and sleep. Sixth one is teaching, guidance and follow-up. Here we are giving this code. Again we are having the 4 subscales are there, and we are giving the marks for 1 marks for each. So 6 to 24 is the total score. Minimum is 6 and maximum is 24. Okay, so then next one is we are having the another score is that is Pionesil. Okay, professional. P is professional, A is assessment, O optimal, N is nursing, C is care, I is intensity, and L is level. Okay, professional, assessment of optimal, nursing care, intensity, level. It is done by dividing the nursing care intensity score by number of nurses to obtain the nursing care intensity. Okay, next is the third one is Rafaela classification system. Here we are having the 3 measurement tools. One is OLU's patient classification system. Another one is daily data of nursing resources, and third one is Pionesil. Next is the Zebra system of patient classification.